Since 2021, federal rules require healthcare providers to give patients electronic access to most test results as soon as they're available electronically. Now, a new study published just yesterday in JAMA found that nearly 7 in 10 Americans who had access to their medical records saw those test results before hearing from their healthcare provider. So what did you do when a result pops up marked abnormal? What if you never hear anything at all? Our KSTP health expert, Dr. Arkel Giorgio, is joining us now with a look at what patients need to know. And Arkel, I appreciate you bringing this topic up. I've had this happen to me, wondering what it means, waiting to hear. So let's start with what this study showed about how patients are understanding their test results before a doctor's even had a chance to explain them.
Sure. Well, of the 7 in 10 people who saw those test results before their doctor called them about it, 2/3 of them felt like they understood those results well or very well, but 1/3 thought they didn't understand them particularly well or sometimes not well at all. So, the takeaway from the study is that giving people information puts it in their hands, but doesn't necessarily give them an interpretation. That being said, this is one more mechanism to make sure that abnormal lab test results don't fall through the cracks, because other studies show that about 1 in 14, 7%, 1 in 7, 14% of abnormal test results do get overlooked and are never communicated to a patient. So this is important.
All right, so this is a way you can absolutely see it. It's just the understanding. Many of us, when we get these results, are going to go and search it up, maybe even use AI to try to understand it. You have some advice, some tips for us about that?
Well, the first thing you want to do is make sure that you understand what to do with an abnormal test result. So the first thing that I suggest that people do is scan the results and look for the word critical. It could say critical value. It could just say critical. Look for that word. Sometimes it's in red. And if you see that, that's an indication that you should contact your doctor immediately. Not necessarily go to the emergency room, but it means that it needs to be addressed. So let's get that out of the way. Look for the word critical. Then you want to look at how abnormal the result is relative to the range that is listed online, because next to every value is the reference range, the normal range. That doesn't mean that if something is way out of whack that there's disease or illness, but it does give you an indication of how abnormal it is, because you want to put it into context. And then you want to look at your previous lab results. Is this new, or have you always had this abnormal lab result? Context is really important. And the best thing to do if you have any question at all is to write in the portal back to your doctor, back to your provider. Is this something that we need to follow up on sooner rather than later? And so those are the things that I would do within that first pass of looking at your lab results.
All right, so important. All right, Arkel, we thank you for bringing this to us. And of course, we got to make sure we're being smart when we're searching up these results on our own as well. Dr. Arkel Giorgio, thank you. We'll be right back.
You bet.